Welcome. My name is Peter Strong. I'm a professional psychotherapist, but specializing in mindfulness therapy for the treatment of anxiety and depression and OCD and other emotional problems using mindfulness therapy and mindfulness-based techniques rather than medications or the conventional talking therapy that you may be familiar with. Mindfulness therapy really tries to address the underlying process that causes your anxiety or depression or problem with intrusive thoughts and obsessive-compulsive disorder. So Skype Therapy for OCD is one of the services that I offer. All my online therapy is done via Skype. It's very important that you use Skype or FaceTime or similar video platform because it's important that you can see each other during sessions. This makes the therapy sessions much more effective than non-video based online therapy such as chat sessions or email sessions or following some kind of online program. It's much better if you can see each other in person. If you use Skype or similar service so that you can see each other, then the quality of psychotherapy is really no different than if you meet in person. It's important that you can see each other. That's the main thing. This improves communication. Now, Skype therapy for OCD, Obsessive-Compulsive disorder. Well, during the online therapy sessions that I offer, I'll be teaching you how to work with the two primary elements of OCD. So the first element, of course, is to do with obsessive thoughts and obsessive thinking. So there's two types of obsessive thinking that we have to work with. The first is what we might call just basically chronic worrying, that is obsessing over something like germs, for example, which often leads to considerable anguish and converts into obsessive-compulsive behaviors such as repetitive hand washing or trying to clean every surface that you come into contact with in case of the possibility of it being infected with pathogens. So excessively worrying about that and obsessing over hygiene is one kind of reactive thinking that greatly accentuates the underlying anxiety. The thinking fuels anxiety, it feeds anxiety, and it intensifies the anxiety. So that's one kind of thinking process. The other kind of problems that people run into with thinking is intrusive thoughts. Intrusive thoughts, intrusive images, intrusive memories. Now this is rather different than pure obsession, because you're not actually trying to think about the subject, as with hand washing. You're not obsessing about that activity. Instead, you're trying to stop these intrusive thoughts and disturbing images from arising. You don't want to engage with them. So this is sometimes called pure O, sort of a pure form of obsession that's caused by intrusive thoughts that really obsess the mind and cause considerable anxiety. So that's one side of the work. We work with these obsessive or intrusive thoughts. And the other side of OCD is working with the compulsive behaviors. So the thoughts convert into behaviors like hand washing or trying to clean every surface in the house multiple times over, or whatever it might be. The compulsive behavior is a response to the obsessive thinking. And whether we're working with thoughts, either obsessive thoughts, intrusive thoughts, or compulsions, they all have one thing in common, and that is that the thoughts and the intention to act on those thoughts are all accompanied by a high emotional charge. So they're very highly charged, and that's what causes us to become a prisoner of these obsessive and intrusive thoughts or compulsive behaviors. It's the emotional charge that's the most important thing. That is what actually fuels the process in OCD, much more so than the thoughts themselves or the actions themselves. Those are simply the products of that underlying intense emotional charge. If we engage in the products, if we identify with thoughts and compulsive activities, then that will tend to reinforce the underlying emotional charge. Usually that emotion is based around fear and anxiety. But it could be other things too. It could be based around guilt. It could be based around the emotional charge of feeling like you're a failure, not being good enough. It could be worrying excessively that you're not being heard by your partner, or that you're not communicating things clearly to another person. It could be a whole range of things that are causing your emotional suffering. So it's really important and to understand that the real problem is not the thoughts or the activities, it's that underlying emotion that's fueling the OCD. So that's what we work on during mindfulness therapy. We would typically imagine the obsessive compulsive thought or activity. We would play it through in the mind, and we would watch to see what kind of emotion is triggered. Typically fear or anxiety, but it could be other emotions, as I say. When we see that emotion, we then start to build a relationship with the emotion itself that's based on consciousness. That's where the mindfulness comes in. So typically we do not have a conscious relationship with our intrusive or obsessive thoughts and activities. They typically are habitual in nature. They operate out of consciousness like any habit. And they operate at this sort of automatic level of activity. And that is the first real problem in OCD, is this lack of consciousness. We may be very aware of our obsessive or intrusive thoughts, but are we conscious of them? Do we have a conscious relationship with them, or do we simply become consumed by those thoughts and then become reactive? So developing a conscious relationship is vital. That's the first stage of change. When you can become the observer and stay present with an intrusive thought or distressing image without reacting, then things begin to change very quickly. So that's the first focus, establishing this balance in relationship to thoughts, emotions, and impulses. The second part of our work in mindfulness therapy is to see how those emotions work, to look at their structure. And it's become very clear to me through working with people over many years now that the primary structure of the emotions, it's not thoughts, it's imagery. So the thoughts are products of the emotion, but what causes the emotion is imagery, psychological imagery. The way that you see that fear or anxiety in the mind is what determines its intensity. And that in turn leads to the propagation of thoughts and compulsive activities. So we examine this imagery in great detail during our mindfulness work on our OCD. We literally meditate on those thoughts and the emotions underneath the thoughts to see how they work, to look at their imagery, to see what it is about the imagery that causes them to be intense, that creates that intense emotional charge. Typically, there are certain properties that all emotionally intense thoughts or emotions have in common, and that is they're typically too large in size, they're often too close, and they're often too high in our psychological field of awareness. These properties are what create the emotional distress, the anxiety, the fear, whatever it may be. So when we see how it actually works, we can begin to change this imagery. And when you change that imagery from its habitual form into a new form, you change the emotion. So this is a primary way that we can help the emotion heal. And when you help the emotion heal, then you're taking away the fuel behind OCD. So we work a great deal with the imagery of our emotions. We work on making them smaller. That's very classic, that's very typical. We move them further away in our imagination. We move them to a lower level. For example, place the thought or the emotion on the floor. See it as being the size of a grain of sand. Check out, and you can do this now, you can try this. Check out how it feels when you change its imagery in some way. You'd be quite surprised. Even very distressing, traumatic memories can be essentially neutralized by doing very simple things like changing their size, making them very small and putting them at a lower level where they will have less power. These are some of the mindfulness imagery techniques that we explore during our mindfulness therapy sessions together. We find what works, and then we cultivate what we find to be effective. And in this way, we retrain the mind out of the obsessive and compulsive emotions that fuel OCD. We retrain the mind so that it's no longer triggered into patterns of OCD. So if you'd like to learn more about how to work with either obsessive thinking or intrusive thoughts, memories and images, and also to work with compulsive behaviors, then please contact me. Let's schedule an online therapy session via Skype. Skype Therapy for OCD is a very effective way of learning how to manage OCD. Most people see quite dramatic changes after the first 3 or 4 sessions. Once you learn how to apply mindfulness to work with your OCD, you'll see very encouraging results. So if you're interested in Skype therapy for OCD, then please reach out to me, contact me, tell me more about your particular situation, tell me what times and days work for you, and then we can go ahead and schedule the first Skype therapy session to help you overcome your obsessive-compulsive disorder. Thank you.